Hello and welcome to King Marshall, where we create a positive impact into your health and lifestyle. Guess what? Today we are going to continue with antenatal clinics or the importance of pregnancy care. But today we are going to be checking specifically on what do you expect when you go for these visits. So we are going to be checking on the expectation you need to have going for the antenatal clinics. So the expectation for A and C. So the expectation for pregnancy clinic. So to begin it, in any hospital when you go, you need to do the registration part of it. You need to give your details. If you are needed to pay, you need to pay some cash. Depending on different facility, that's important to start with. And then from there, you're going to do some routines which you do from the time you arrive to the hospital until you end. So the common things that you expect to be done, one, you are going to do the basic vital signs. Basic vital signs that are done, for especially for antenatal mother, we check the blood pressure just to see how you are doing. We check the pulse rate just to see how it is. We check the body temperature. This gives us a sign if you could be having any fever or infection. We check for respiration rate. How are you breathing? How fast is your breath, or what's the rate of your breath rates? We check on weight, which is also very important parameter during this pregnancy clinics or pregnancy visits. Another thing that you may see them do, which is uncommon to other clinics that you do, they are going to check maybe your HIV status. It's a common test which is done for the partners, especially if you are a couple. It's the best time to do it on your first visit, so that you can check what's the status of the father, what's the status for the mother. The main thing we do this is to protect the unborn child, just to ensure we have a healthy baby. We are going to expand much on them even as we continue tackling each package at its own. Another thing that you'll see them do, they are going to take a history taking. They are going to take history taking. So for the history, they are going to check when did you experience your last menstrual period, the first day that you experienced your last menstrual period. They are going to ask you, how is your family? Do you have a condition like diabetes in your family? Do you have a condition like hypertension in your family? Do you have heart problems in your family? Do you have any chronic condition in your family? They are going to check, do you have tuberculosis in your family? You yourself, have you been infected with TB before? You yourself, have you had any of those chronic conditions, and how do you manage them? These are very important because they give us a lot on what to expect in your pregnancy, and they help us know what are the risk factors that you will be carrying you as a mother during this pregnancy. Another thing that is important, you see them do a series of lab tests. So they'll do a series of lab tests to check different parameters which could be a risk to your to the baby and also to you as a mother. So we are going to tackle exactly what tests are the basic tests that should be done. But most importantly, the sample you see them taking is the blood and urine. Yes, they will inflict you some pain in your first clinic. Another thing to expect when you go for these antenatal visits, other than the lab test, they are going to do some scan. In Kenya, currently you are saying you should do a minimum of 3 scans. In other countries, they say 5 scans. And some other places, they say 8 scans at least. And in other countries, they say at least 2 scans. But we are going to check what's the importance of each and every scan that you do. Don't feel shy off to do the scans. They are harmless to your body because they just use the sound to evaluate how the baby is in. So they are not going in any way to affect you and the baby. Unlike other examination like X-rays and CT scans. So don't shy off when doing these scans. They can't cause any harm to you or the baby, and you can do as much as you want, as much as the obstetrician or the gynecologist you are following will require, or the nurse or the clinician following you. Another thing that you are going to see or you are going to check is they will do a lot of teaching. So you'll be taught all through the pregnancy, and some of the teachings include on your nutrition status, how should you eat, what are the importance of feeding, at what duration should you eat. You are going to be taught how much water should you be taking, which is at least 2 liters. You are going to be shown some exercises that you will be doing as a mother. You are going to be shown what do I pack on my pregnancy bag. That's the bag you carry along in case you get emergency labor. What should I be having in my bag? They're going to teach you on how to plan for your delivery, how to choose the adequate hospital for your delivery. They're going to choose to help you how to take the financial precaution. Maybe you can use the NHIF, how to take Arinda Mama. All these things you are going to be taught during these clinics. And it's important you go as a couple because you are able to listen together during this clinic together with the health worker, and that's you make decision more faster when you are in a couple than going to discuss and then coming to ask the question later to the health worker. So other things that you expect is some kind of prophylaxis or some treatment which you might be given. You expect to be given tetanus toxoid. This vaccine given to all mothers to prevent you against the tetanus toxoid. Also, depending on the blood group which you are done. Blood group is one of the tests that we'll do in the lab. You might receive or you might not be given anti-D. Anti-D is an anti-rhesus factor. You see, most of pregnant mothers who are rhesus negative, they end up getting some injection which we call anti-D, which are a bit expensive. They range all the way from 1,500 to 2,500. But with antenatal clinic, even if you are needy, you are able to be advised where can you go and get maybe the government sponsored these vaccines, anti-Ds. And with that, you are able to bring out a healthy mother. Another thing that you expect to get is a booklet. It's only in antenatal clinic where you are giving the notes to carry on in any clinic, so that all health workers can see how has this mother been. Is there any risk that we are expecting from this mother? How are we managing this risk? So always when you're going for this clinic, once you are given this booklet, ensure you always carry it in all clinics that you go. Another thing that you expect to get, especially if you go to these government clinics, some private get these things, treated mosquito net. We give mothers treated mosquito net just to protect malaria. And if you live in malaria endemic season, these are the regions where malaria is so common, or there's this Anopheles mosquito and malaria is so common in those regions. You're going to get a vaccine that will protect you against malaria. So that's why you'll see in some region you'll get the vaccine for malaria, in some regions you won't get. But in every place you'll get the tetanus toxoid. In every place, if you are rhesus negative, you're going to get anti-D. In any place, you are entitled for a net, especially for pregnancy. You might end up getting 2 nets. I'll tell you how or when do you get 2 nets, which are treated. And also, in every place, you are entitled to get a booklet. And also, it's your right to get healthy messages and to inquire any question that you need to be clarified by health workers. Thank you so much for watching this video. I hope it has created impact into your life. Let me see you in the next one, even as we expound on these parameters, why they are important in your pregnancy, as we work out to get a healthy mama, a healthy baby, and a healthy husband. Thank you so much. See you on the next one.